today about oral health. What do I want to talk to you about today is what causes people to lose their teeth. But before we dive into the subject, I want to read you the statistics. Um, 7% of people have lost, according to the CDC, which is the Center of Disease Control. 7% of people have lost at least one tooth by their 17th birthday. In fact, I fit into those statistics because I lost one of my front tooth when I was 15 years old. So I fit this description. And the crazy or the sad thing is also that this number, the 17%, increases to about 69% of people who have lost at least one tooth. For people to 69% for people who are between 35 and 44 years old. So in that group, 69% would have lost at least one tooth. Another statistic is that one or six people, about 17% of adults age 65 and older, have only 8 teeth or less remaining in their mouth. And then another statistic I want to share with you is that about 25% of people who are 65 or older have actually no teeth that are left in their mouth. And, talking about the 17% of the people who have at least 8 teeth left in their mouth, my grandfather was one of those people because as long as I knew him, he only had 2 teeth in his mouth. And unfortunately, they weren't even on the same side or on the same arch. He had one on the upper arch and one on the lower arch. So you can just imagine how difficult it would be for someone who loved to eat, because my grandfather loved to eat and to eat. And so those, tooth loss can be quite debilitating and limiting as far as your life expectancy in many cases. So what causes people to lose their teeth? One of the reasons is poverty, because people are not able to have what is necessary for them to go to a dentist, or they may not have access to a dentist. They have limited transportation, or they may not have, if they live in rural areas, for example, as was the case for my grandfather, they don't have access to a dentist. They don't have access to a dental clinic. They don't have access to maybe even health clinic to where, they can go and seek help. So that's a big problem. Another problem is the lack of education. People don't know what to do when it comes to taking care of their teeth properly. So lack of education, they don't know what to do. This is one of the reasons why we come every Tuesday and we discuss different topics that have to do with oral health and oral hygiene, so that people can be more educated and know what to do. That become less of a factor as to why they may end up losing their teeth. So the good thing is that nowadays people don't have to, and even statistic has decreased. For example, here this one says that about 30%, there's been a 30% decrease from 1999 to 2004, from 30% to 17% of people who have lost their teeth. Because, there's better access, more education. So education is actually something that can really, really help out. And numbers have decreased as far as tooth loss, which is great, right? It's a great thing for that to happen. So what are two disease process that can cause people to actually lose their teeth? One of them is cavities. What is cavity? So cavity, many people ask me sometimes, and even children, they ask me, what is cavity? So a cavity occurs, it is the destruction of the enamel structure, or the enamel, which is the part of the tooth that you actually see in the mouth, like the white part of your teeth that you see in your mouth, your teeth, that part is assaulted by bacteria who are going to feast on the food that is found on your teeth, that remain on your teeth. And what they do is, as they digest it, and they're going to produce acid as a byproduct, and the acid is going to be attacking that enamel and causing holes. And those holes over time can become bigger and bigger to the point where you end up losing a tooth. It ends up causing you pain, and sometimes doesn't even cause you pain, but it can also cause you infection, which eventually causes you to lose the tooth. Another disease process would be gum disease. Gum disease can affect your teeth to where it affects the supporting structure of your teeth, causing your teeth to become more mobile, and eventually you end up losing your teeth that way. So gum disease, you have is twofold. You have gum disease or gingivitis. That's one type of gum disease. Gingivitis affects the gum part of your teeth. So the pink, mostly most people is pink, but depending on your ethnicity, it can also show in different shades. Sometimes it can be brownish. Sometimes it can be, you can have like dark spots around your gum, or sometimes you have people who have gums that are really dark. It doesn't mean that it's necessarily a disease. Sometimes it's just the presentation of your gum. So those tissue become reddish or become puffy or inflamed. So you have inflammation of your gum. And how can you recognize that you have inflammation of your gum? Is that many times it shows off by you having blood. You start bleeding when you brush your teeth. So that's one aspect. But then another aspect is periodontitis. It's another type of gum disease whereby it affects now, infection has gone deeper beyond your gum, and so not only is your gum infected but also your bone also. So the bone tries to run away, as I say, from the infection when I explain it, and so now you have less supporting structure that actually holds your teeth inside your mouth. So that being said, then your teeth become mobile and you end up losing teeth that way. I remember working this one office, and they were specializing in dentures and implants. And so in that particular office, I used to see even young people that would come, and due to many things, they would end up having so many mobile teeth. Some people don't even have cavities, but their teeth are so mobile that they are no longer savable. They cannot be restored. And so that people end up losing their teeth that way. So those are two disease processes that can cause somebody to lose their teeth: cavities and gum disease. So what should you do in order to not be affected by those two disease processes? One thing you want to do is make sure that you at least brush your teeth twice a day, at least morning and night. You want to make sure that you brush your teeth when you wake up, and at night before you go to bed, you want to make sure that you brush your teeth as well. Another thing that you want to do is make sure that you floss the surfaces of your teeth. You want to floss between your teeth. Why? Because the braces of your toothbrush are too big and they're too thick. They cannot go between your teeth and reach those areas. And so you end up developing interproximal cavities. So cavities between teeth, or interproximal cavities. So you want to make sure you floss at least once a day. Another thing that you want to do is you want to make sure that you go see and visit a dentist at least twice a year, for those people who have healthier teeth, or depending on the recommendation of your doctor, if you have gum disease, you may need to go more often. Oftentimes, you want to go once a quarter, as is usually recommended for people who have periodontal disease. So tooth loss can be avoided, and you can do that by following those recommendations. So that's what I wanted to talk to you today. Tooth loss is a thing, and it occurs very often, but it's easily preventable. So if you don't have a dentist that you know of who lives, or who can help you in the area where you live. And if you live where we are located in Arlington, Texas, which is in the Dallas-Fort Worth area, you can come and visit us at Healing Wings Dental. I'm Dr. Valerie Mukanga, and we are located at 4101 West Green Oaks Boulevard, suite number 317 in Arlington, Texas. And our zip code is 76016. Or you may give us a call at 972-213-0202, where you can secure an appointment and we can help you in your oral hygiene journey. And you can also contact us via our website, www.healingwingsdental.com, and we can you can secure an appointment that way as well. So that being said, I really wish you a great day. May your day be blessed. May you build memorable and happy moments. And don't forget to make this day positive because it is within your power to do so. Have a great day. Bye.